Rapid antigen testing is used to proactively identify cases of COVID-19 through routine screening. This is an additional layer of protection to be used in combination with other IPAC practices recommended by Public Health Ontario and your local public health agency. This video will demonstrate the recommended method of specimen collection. The oral or buccal and nasal collection method improves COVID-19 rapid test reliability. There are several different types of rapid antigen tests available for use. For the purpose of this module, we will demonstrate using the BTNX Rapid Response COVID-19 antigen test. It is important to note that prior to using any rapid antigen test, you should not eat, drink, smoke, or vape for at least 30 minutes before collecting the sample. To begin, you need to find a location that offers an adequate space to work, is between 15 to 30 degrees Celsius, or normal room temperature, and has no fans or air that is blowing directly where you will be testing. Gather the supplies that you will need: a test device, a sterile swab, the vial of buffer solution, a test tube with a cap, a test tube rack if it is provided, a timer, hand sanitizer, and either a garbage can or a biohazard receptacle as per your agency's procedure. Begin by inspecting the testing supplies to ensure that the materials are not damaged or that they have expired. Gently blow your nose and discard of the tissue. Perform hand hygiene by either washing your hands for 20 seconds or using an alcohol-based hand rub for 20 seconds. Twist off the top of the vial and carefully squeeze the buffer solution into the test tube. Remove the swab from the package, keeping the swab tip clean. Insert it between the cheek and lower gums, rotating the swab several times. Repeat on the other side of your mouth. Next, rub the cotton swab onto the back of your tongue or your throat, if comfortable to do so, for 1 or 2 seconds. Tilt your head back and insert the swab into your nostril approximately 2.5 centimeters or 1 inch. Stop when you feel a slight bit of resistance. Rotate the swab slowly, pressing against the inside wall of your nose approximately 5 times, and leave the swab in place for a few seconds. Repeat the same steps on the other nostril. Insert the swab into the test tube. Plunge the swab up and down in the test tube for approximately 15 seconds. Make sure that you rub the swab against the sides and squeeze the tube. The plastic is soft, so you can squeeze the liquid out of the cotton tip into the tube. Follow the manufacturer's instructions for processing time. For this rapid antigen test, you must leave the swab in the test tube for 2 minutes prior to dropping the solution into the cassette. Open up the testing cartridge and lay it on a flat surface. Remove the swab from the tube and discard it in the garbage or biohazard container as per your agency's procedure. Depending on the brand of rapid test that you use, you will put the lid on the dropper and drop either 3 or 5 drops into the well of the testing device. For this brand, it is 3 drops. Discard the dropper as per your agency procedure when complete. Remember to perform hand hygiene and then set a timer for 15 minutes, leaving the device on a flat surface. Remember to disinfect the area thoroughly. the test begins to process, you will see pink lines appearing, but do not read the test until 15 minutes has elapsed. If at any time you drop the swab or contaminate the test, discard it and repeat again. After the 15 minutes is up, you will receive one of three possible results: positive, negative, or invalid. The one we hope to see most often is a negative result. It will be one line at the C with no second line in the window. If that is your result, you are going to discard the testing cartridge as per your agency's procedure and complete your hand hygiene. If no lines appear or there is only one line at the T mark, this is considered an invalid test and you need to repeat the test from the beginning. If you receive two lines on your test, the C and the T, this is a positive result. If at work, you should immediately don full PPE and isolate and inform your manager for direction. For congregate or high-risk settings, a positive result on a rapid antigen test should be considered a presumptive positive, and it is recommended to have the result confirmed with a laboratory PCR test, although this is not a requirement. Also note that rapid antigen screening provides a point-in-time result. A negative result does not guarantee an individual is not contagious. If you have recently been exposed to COVID-19, you may still test positive at a later date once there are enough antigens in your system for the test to detect. That is why routine screening is important. If you have any questions about this method of specimen collection, reach out to your local IPAC hub for assistance.